first of all, my compliments to the organization of this Congress, to Professor Domingos Neto, to Enfermeira Ana Moreira, to the President of this table, Dr. António Paiva. I don't know if you know, sorry. I don't know if you know this film. It's quite a well-known film. O final. Não, isto é só para dar aqui. Sorry, I'll speak in English. This is just. Ficou vivo, com o volante. Ficou com o volante na mão. No, after all, Dr. Paiva says, after all, he had his will on the hand and he is alive. And he's alive. That's a hope. That's a hope. I'm talking about institutional therapies, and that reminds me past movements in the 60s, and that was the anti-psychiatry movements, also known as alter psychiatry movements, with David Cooper, David Lang, Frank Basaglia, Thomas Saz, I don't know, with this, the making of the madness. I don't know how you translate that to English, but it's something like that. I remember in 1975, in the Reitoria, the first Congress of Psychiatria Social, Dr. Guilherme Pereira, who organizes it, and I remember my estranheza, como é que se diz? Estranheza, my awareness about a long-haired psychiatrist, and one of his assistants presented something with playing it in a viola, in a guitar. It was one of his assistants presented it in playing a guitar, the presentation. That's in the States, that's the LSD father, Timothy Leary. And the American with the peyote, also another one, that's the Castaneda, with the peyote, with the champignon, cogumelos. Oui, Castaneda. But institutional psychiatry was an expression created in 1952 by a psychiatrist, il était français, François de Maison. And he designed a therapy based on a therapy of madness, but on the causality of mental illness. And he tried to reform the institution. It's quite difficult to translate to English, I must say. To reform the institution, privilegiando, putting in first place the relation with the patients, between the patients. Stepping out to what I do, I work on an institution called CALM, that's in Hélier-Combray, France. That's it close to Chartres, 80 kilometers from Paris. Hélier-Combray, it's the land of Marcel Proust, and one of the biggest writers in France. He was from Hélier-Combray. When I arrived to France, I bought his book, Em Busca de Tempo Perdido, regarding for the lost time, en recherche de temps perdu. I never read it. It's 1,500 pages. Costed me 35 euros, but I didn't read it. But the book is all relational with if I. He regrets his life. Treatment on that institution is based on. I forgot. Is based on a place. Wait. That's a nation in. Posada. A nation in, and we wanted that it is hospital and clinical, but didn't look like didn't look like an hospital institution. Something beautiful, romantic, very more words, very calm. Yeah. Calm, that's the name of it. Normally we have 40, 50 patients. Normally they have groups of 10 entering every every Tuesday and getting out every Tuesday, always on the renovation group. Proposally they meet themselves so they can, those who enter meet those who get out or go off. We have our people, our staff people. We have doctors, nurses, social assistant, administration, informatics, pharmacy, assistentes de quartos, quem arruma os quartos, como é que se chama? Assistentes, room assistants, como é que se diz? Assistentes de quarto, assistentes de secretaria, assistentes... Housekeepers. Well, those who manage the place. Those who manage the place. Yeah, that's right. We treat the different pathologies derived from addiction. As you know, anciently we have those very alcohol and other drugs. Nowadays we talk in because there was also an evolution, we talk in addictology. As you know, anciently we had those alcoholics, and they still are there, but they have 60-year-old, 70-year-old. So that all changed because we have lots of young people with other addicted pathologies, mainly cocaine, ecstasies, methamphetamines, amphetamines, lots of hashish. And they use normally alcohol, as they say, to go down because they have all those drugs develop lots of anxiety, and they have to use the alcohol as a downer, like the Americans say sometimes. We receive all those polyaddictive with all its pathologies also, like AIDS, hepatitis B, hepatitis C, pancreatitis, cirrhosis, esophageal varices, something I wrote I don't understand also, but I think it's important, but I forgot. Normally, we have some main points because it's an institution. That means that everyone has a role. We have different roles in the institution, a doctor is a doctor, a nurse is a nurse, the cooker is a cooker, but all we treat ourselves by, on se tutue, on se traite par tu, comment ça dit? Tratamos por tu.
We call it
No. Ah, no. Informally. We treat ourselves informally, normally by the first name. That's how we treat ourselves. We have some main points. The patients arriving on a Tuesday? Yes, on a Tuesday. Normally arriving on a Tuesday, they have a 1 week detoxification, that's une semaine de sévrage. It's a medicalized detoxification normally. That depends on the drug they use. They can be on the alcohol. With the alcohol, normally we use the diazepam en décroissant. It's the diazepam always going down until a week. We can start as high as 80 milligrams per day volume, 120 milligrams a day volume, the diazepam, that's no trouble. We have all the other drugs like mostly opiates. With the opiates normally it's always the carbamazepine, tegretol and things like that we use to cover up the detoxification. After the 8th day, they all start, because they are groups of 10, they all start in sections of learning. And the sections of learning, they have 8 sections of learning in addictology, the effects on alcohol on the body, the effects of what is the dependency, the mechanism of relapse, mainly theoretical stuff. 8 sections. They have also 13 sections on learning, relaxation and meditation techniques. And they have 12 sections of psychotherapy of psychoanalytic inspiration. I'll read all this, and I'm almost finished it, and I must change it. That's one of the problems, because normally it's here alcohol, but mainly for all the other drugs. Problem. Then we have malestar, not feeling good, alcohol, feeling good. The big seduction of alcohol and lots of drugs, it's the immediate and direct going from the sufferance to the well-being without the psychic elaboration. Some of the modern medications are also fits also on this. Especially in France, now they have the phenomenal Revia, which in Portugal is called Nalorex, Bazinal, Naltrexona, which for us is not so phenomenal as that, because it's old at 30 years, something like that in Portugal. For them is a very new and very good medication, astonishing medication. Also in France, they have the baclofen in high doses, which for us is not a phenomenal, but because we used to have it in the orthopedic, like real Lioresal, as a muscle relaxing. Exatamente. Actually, they used to have Lioresal, 1 tablet, and all the orthopedists were very worried about the stomach and the effects of 1 tablet. Nowadays in France they use 5 tablets 3 times a day, 6 tablets 3 times a day. In my opinion, it's a muscle relaxing important. The person relax the muscles, relax the mind, and has no pique, no will to do anything. Not the alcohol, not the drugs, but nothing almost, something like that. We have also some other weapons. That's still on the equality doesn't mean differentiation. That's the last sentence. Each member of the personnel participates not only with his techniques and specific formations, but also as a person. that's how they start on Dernier Verre, last cup. It's a bye-bye of life mood that was, and they're starting a voyage to the interior of themselves. That's Socrates. 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 Yeah, well, that's something like what is seen, the psychoanalytics. I don't know. I'm not a psychoanalyst, but they define this as the different levels of conscience, like different levels of conscience, inconscient, and things like that. Yeah. Yeah, no. Hã? Epá, mas isso. That's the main sentence. I'm fed up of being false. Here we have Capitan Doc with Scotch whiskey, but the other things is he was having a lecture of something, and he drunk and he said, I feel very, very, very instruit, very educated. Sometimes we cannot express what we have in our thoughts. Some other times, something more confrontative. I'm here, looking for myself, confused and with fear. I carry my life on shade. I reject everyone that worries with me and love me. I became estranged. I told you my English was beefsteak English, so I'm sorry. I became estranged from my family. The fault, the guilt, the lie, and the pain are my best friends. Drugs are my pals, and drug is my best friend. We have two more weapons, which I consider very important. We have a contract of therapeutics efficiency. That means that you're not allowed. And the contract, if one rule is break it out, the patient will go out immediately. And that means no drugs or alcohol during the treatment. After a week, after the medicamentalizada desintoxicação, after when they finish medication, they start going out every day. They have a right to 1 hour for a walk in groups of a minimum of 3. Why 3 minimum? Because if something happens, as you know, especially with alcohol detoxification, sometimes arrives, they have DT, the delirium tremens, they have crises of epilepsy and things like that. And it's always supposed on the going out when has some crisis like that, some should I say crazy epileptic crisis or something like that. One goes and advises, the other stays with the patient who's there. Yeah, that's about the. So that's groups of 3, and they have to respect it, and they have to respect the 1 hour walk also. There's another thing on the contract of therapeutic efficiency. Efficiently. It's no love relation during the cure. Why not? No love relations, because the objective is to concentrate themselves, always themselves. We have 2 more weapons. I'm not going to read this, don't worry. It's, we call it the team meeting. Every week there's a team meeting. The team meeting where we discuss the functionment, all of us. That means the cooker, the doctor, the nurse, and the assistants, something and something and something. Normally 20 people. We discuss everything. And we discuss general things. We also discuss always some points. And the same points is the patients at the hospital, because as I told you, sometimes we have esophageal varices, we have patients with Wernicke and things like that. We have the organizations of rooms. There are 2 in a room. We change partner every week. We do it purposely. We discuss the future entrants. We discuss the entrants that are already there the last week. We discuss the entrants that's going out. Also, we discuss the general mood in the clinic, because suppose sometimes it's said that someone is smoking hashish and everyone starts getting nervous. We have to have the feeling of that. Some other times, suppose the cooker tells us the table number 2 is not eating what he is supposed to eat, and we try to find out what's going on. Why doesn't he eat? And we have another weapon, and that's the general meeting. That's on the Thursdays. It's normally all the patients get together, those who have entered, those who have getting out, with the doctors, the nurses, and invited people, and people who want to assist it. Constructions is difficult, but it's possible, and that's it. That's all.